Melanoma is not a typical cancer in any way, shape, or form. Depending on how thick it is and how many different qualities it has, it can have a very high risk of relapse even after the surgeon takes it out.
Patients who have a familial history of melanoma are automatically at a higher risk factor of getting melanoma. And if you combine that with the environmental impact of increased sun exposure, that puts you at a higher risk. And if you have multiple lesions that have been managed where they're sort of moving at different rates and at different times, it becomes more difficult to follow these over time. This is a skin cancer that can actually go up to the border of the skin, and at times when it goes beyond the basement of the skin level, it can then potentially spread. That's when it's called metastatic, because now it's left the skin level and it can enter the nodes. And once it goes beyond that node, it can actually go to other organs. And that when it becomes a distant metastasis. Metastasis meaning that it's spread beyond the area where it was originally seen or diagnosed. So it's important to understand that you can essentially cure the patient who has a lesion in their skin. In fact, studies have shown that you can dramatically improve your rate of clearing the cancer if you go ahead with the excision within the first 30 days after the diagnosis.
So adjuvant therapy is what we add after surgery to decrease the chance that that tumor will return or relapse. And it clearly prolongs the time to return of the tumor. It reduces the risk of relapse or return of the tumor, and in one case, it clearly prolongs the survival of the patient. 95% of all the relapses will have occurred by year 5, and at year 5, you feel like you're pretty close to being out of the woods. And you just got to go about your life.